Welcome back to Rohrich Knows podcast, helping you become a better and more informed you. Let's talk about a very commonly asked question I get in the office is, I've had Botox time and time again for years and years, and it just doesn't seem to get me the top results anymore that I want. So I see this not infrequently because I've been injecting Botox for almost 20 years. So what do you do when Botox doesn't deliver? And how do you enhance your results? So there are really 5 things you can do because it's really called Botox endurance. And so sometimes you should take a strategic break, allow your body to reset its response and reducing potential resistance. And usually 6 months is fine. And then the other thing I usually do first is I switch to another neuromodulator. Dysport, Xenamin, Daxxify, Jeuveau, they all work differently, but they have incredible effectiveness. And another one that I'm going to talk about is a line relaxer, which is a skincare product. It's got some peptides and then some collagen boosting treatments, and then just optimizing skincare. So this is a good topic because I see it all the time, and I'm just going to run a clip on from Bida Farrell, who actually is an amazing injector, and she has some good tips for us.
Why you should do a Botox detox. Number 1 is if you have been getting these injectables consistently for a long period of time and you have not allowed the muscle to ever wake up. Meaning if you've been frozen for a long period of time, take a break. The muscle is a cushion under the skin, and if it continuously gets injected, it will atrophy or shrink, and it will actually make your skin appear older. Number 2 is if you have become tolerant to these injectables, meaning the units required to achieve the same results have gone up, take a 6 month to 1 year break. Our bodies are smart, and if they frequently and consistently see the same medication, they will upregulate their receptors and you'll require more to achieve the same results. So take a break and let your body recalibrate. And number 3 is if you plan to see a plastic surgeon for a consultation, then don't get injectables for a while so that they can see you as fresh of a canvas as you can be.
That's great advice, and I've had Bida on a couple of times, and especially the last one. Certainly, I wouldn't do any Botox or fillers for several months before you consider having plastic surgery, especially on your face. So let's analyze some of this. So switching to another neuromodulator, I think this is a very powerful way to do it. Many times I'll switch to a like Dysport or Daxi or Jeuveau because they're a different type of neuromodulator. They work slightly different on the muscles, but they're still in the same class of drugs. So I think that's a very powerful and important first step to do. And the other thing is take a break. Take a break from Botox. In 3-6 months, it'll help reset your body's response, reduce tolerance, like Bida said, and then go back. And then either you can try Botox again or you can try a different neuromodulator. And then another one that actually is very powerful. This is from a great skincare company called Revision. This is called the Revox Line Relaxer, and basically it helps to augment the results of Botox, and by doing so, by reducing fine lines and improving skin texture. And it works synergistically in a clinical study to show that it actually is additive. So I think it's very powerful because the ingredients are obviously a blend of 5 peptides with GABA, and these blend together and they help to reduce fine lines, but they also augment the neuromodulator. So I think it's a very powerful tool, and I actually use it in a lot of my patients. So pre-op and post-op, it helps to increase the duration of the neuromodulator. And then adding skin boosting treatments are very important as well. Do them a week or before after neuromodulators, microneedling, radiofrequency treatments, anything to increase collagen production and improve skin tone is really going to work hand in hand with Botox to enhance the overall smoothness and firmness of the skin. And then the last thing is just refining your skin routine. Use products that have peptides in it, retinoids, exosomes, and hyaluronic acid. Those powerful 4 are critical for having smoother, better looking skin and support the wrinkle-free effect of Botox. And that can maximize your glow. And that's really what you want. You want to minimize, the side effects, but you want to maximize your glow. And the other thing is, I always tell my patients, if you're doing Botox, even if you're not early after Botox, don't exercise for a couple of days afterwards, because I've seen in patients that really exercise a lot, that are a little leaner, they actually tend to burn through the neuromodulator much faster. So I hope these 5 ways have actually been very helpful to you to enhance your Botox results, and talk to your physician, your injector about these, because they all are science-based, make sense, are easy to institute, and it gives you a natural looking result, and that's what you want, that lasts a little longer. So try it. Know before you go, and let me know in your comments if you've tried any of these and how we can help you. So until next time, helping you become a better you. Stay tuned and subscribe to more episodes of Rohrich Knows Podcast.